Our study explored the feasibility of PreActiv, a digital platform which creates personalised and dynamic prehabilitation programmes to optimise fitness for surgery. This research was done in collaboration with the University of Bath and Royal United Hospital Bath. Research shows that prehabilitation improves post-operative outcomes. Supervised prehab tends to be most effective, but is not necessarily preferred by patients. Home-based prehab is more accessible, but traditional home exercise is often not tailored or progressed, making it less engaging and ultimately less effective. Digital prehab may overcome many of these pitfalls. In this study, we evaluated the feasibility of PreActiv's digital prehab against traffic light criteria for retention and adherence, where the red range of 50% or less indicates that a definitive study is not viable. We defined retention as the proportion of consented participants who completed follow-up measures, and adherence as the proportion of study completers that did all of their exercise sessions. Patients attending pre-op assessment were eligible if they had no contraindications to exercise, were not meeting physical activity guidelines, and had access to an internet-enabled device. 54% of patients invited were recruited, with the university visit posing a barrier to enrolment. After baseline measurements, all participants were given access to PreActiv, which created an 18-session vigorous intensity interval training program. 35 participants provided informed consent and 24 were retained, which falls within the amber range of our traffic light criteria. 88% of participants completed all exercise sessions in their program, achieving the green range of our progression criteria. Participants enjoyed the program and found it beneficial, but were frustrated that it did not continue to their surgery date. These figures show pre-post changes to fitness, with individual data points connected by dashed lines and group medians shown with horizontal lines. The left and centre panels show that there were only small group-level changes to ventilatory threshold and VO2 peak. However, there were potentially meaningful improvements for 5 participants who increased their ventilatory threshold from below 11 to above 11, indicating lower risk of post-operative complications. The right panel shows that sit-to-stand scores increased by 42% on average. Tailoring prehabilitation to surgery date may provide greater stimulus to increase cardiorespiratory fitness and would improve patient satisfaction and retention. Replacing university visits with remote measurements could further improve recruitment and retention by removing barriers associated with face-to-face appointments. This study met criteria to progress to a definitive study and showed promising data around the efficacy and acceptability of digital prehabilitation.